Roberto Clemente Santa Ana Health Clinic, launched in 2004, provides free and low-cost medical care to needy families in the villages of Limon and Tula on the remote Pacific coast of Nicaragua. There are volunteer opportunities for U.S. medical students and others who donate their time in the clinic and with the local educational and prevention programs. Students from George Washington University recently spent their break making a difference in this community.
What was it like? It was great. Great. Everyone was fantastic. The people, the doctor, Ernesto, Juan, Martina, everyone was great.
Well, this organization started in 2004 with the idea of one of the founders, Julia Gath, who visited Nicaragua many times and in a very remote area to discover that was very poor healthcare facilities for this community. The first hospital from where our clinic is kind of located one hour and a half for any emergencies. So this came as an idea, a brainstorm idea from the founders.
Well, I think this program was a great opportunity for us to see what health problems exist in developing countries or countries that are struggling with healthcare systems as a whole. And coming here to Nicaragua especially, it's an environment where you can see how a clinic operates and what the needs are in the community. So I think it's a great opportunity to learn and to help at the same time.
So far, volunteers have come from as far away as England, Canada, and many states in the U.S. The gamut of skills that college students and senior professionals have already brought to the clinic's communities range from teaching first aid, nutrition programs, hygiene education, deworming programs, and dental and surgical brigades that come to the clinic on a regular basis. These experiences exemplify what a volunteer can do for this clinic in this community.
And when we went to purify the wells, the children came along with us, and they were so excited about doing it themselves, and they would count along how many spoonsful do you need to do, and they would it was just fantastic. It was so rewarding.
This 1,240 square foot primary care and triage facility is staffed by a full-time doctor, 3 nurses, 2 pharmacists, 4 administrative team members, and a driver. The clinic supplies low-cost medical care to the isolated villages of Limon and 27 surrounding communities of southwest Nicaragua. The clinic is named for Roberto Clemente, who played baseball for the Pittsburgh Pirates from 1955 to 1972. Launched in 2004, the clinic is a result of generous donations from private individuals and the contributions of volunteers. When the doors opened the first year, the clinic had a part-time doctor and approximately 300 patients. Now they treat more than 13,000 patients per year.
In 2010, we were able, with the private donations, people like you and Liana, who come with $40, $100, we were able to purchase the first ambulance in the area.
Oh, wow. And an ultrasound.
And
just recently, the first ultrasound.
Exactly.
That's exciting.
This year we were able to buy an ultrasound, which is very important for diagnostic all kind of disease. And the ambulance is very important because it has been saving so many lives. You cannot imagine all the critical cases that come to the clinic, and they really, this community of Limon in Nicaragua, which is at the southwest of Nicaragua, is very, very thankful that we have the clinic and that they have an ambulance.
As the number of volunteers has increased drastically, so has the ability of this clinic to grow its outreach program.
It was an amazing experience, and the part that I think I got the most out of is seeing public health work on the ground. So it was just amazing that all these things we learn about in the classroom every day, we got to see and do in Nicaragua with a rural community.
I think there are certain stories that stand out. I mean, we got to do so much. We were able to teach lessons in schools to kids on nutrition and basic hygiene and water and sanitation.
Thanks to the volunteers, we are able to outreach outside of the clinic to the community. And last year we saw approximately 9,000 patients, and we add to 4,000 more people that we were able to reach thanks to the volunteers. People can come any time of the year. As I mentioned, we accept any profession. Doesn't have to be a medical profession, could be any career. You can come and help to the community. You can interact, as Liana was mentioning, we take into the schools, we take into the mini hospitals that we have in the community. If you are a medical background, this is a great experience for them to really, hand touch how our people, our doctors treat patients. You don't have to be even in public health. You can be administrator, or you can be any career can help us in some way.
You may ask, how was the growth of this clinic possible? Well, in addition to monetary donations from individuals, the clinic receives the donation of time and resources from many volunteers around the world. The driving force behind its success is the volunteer program. When you volunteer abroad, it's not only the people in need who benefit. Volunteers enjoy powerful feelings of purpose and a strong sense of accomplishment. Volunteering abroad in Nicaragua offers the opportunity to experience other cultures, to learn things not found in books or classrooms, and to gain a new perspective of the world we live in.
So when people go to our website, it's called www.nicaclinic.org, and they can find the information and just contact immediately, and we tell them that they can go any time of the year, and they're welcome.